Yo, what's up?
Hi guys, welcome back to my channel. This is Mihir from Propio Junction. So in this video we will be covering the part 2 of shoulder complex, and I already did part 1, so if you want to check it out then the link is in the description. So in this part 2 I will be talking about AC joint. So the first question is, what is the full form of AC? It's air conditioner.
Yo, what's up?
Coming to the point, AC means acromioclavicular, and it's between the acromion process of the scapula and the lateral end of the clavicle. Now I will show you the 3D on the 3D skeleton how the AC joint looks. Firstly, I want to show you the AC joint from a superior view. So that's the acromion process of the scapula and that's the lateral end of the clavicle. Now from a posterior view, that's the scapula and that's the clavicle. So I hope you get the idea how the AC joint looks like. That's from a side angle, and this is the inferior. I removed the humerus. My friend, now you know what AC joints looks like, and it's no more an alien word for you, but you might still be thinking like, what's the need of this AC joint? So the main function of AC joint is to provide additional range of motion at scapula. More specifically, if I say at scapulothoracic joint, which we will be covering in part 3. The second main function of AC joint is to transmit unwanted forces you get from upper extremity or lower extremity or a direct hit on AC joint. So guys, now let's talk about the ligamentous support of the AC joint. So the first ligament is the acromioclavicular ligament. So according to its name, it should be between the acromion and the clavicle. So it's right there in the picture, you can see, and it has 4 bands: the superior band, the inferior band, the anterior band, and the posterior band. The main thing about the acromioclavicular ligament is that it directly encloses the AC joint capsule, which is very important for the AC joint stabilization. And among 4 acromioclavicular ligament, the superior acromioclavicular ligament is the strongest one because it is directly reinforced with the trapezius and the middle delt upon neurotic fibers, thus making the superior aspect of the AC joint stronger than the inferior aspect. The next ligament is the coracoclavicular ligament. So according to its name, it should be on the coracoid and the clavicle, and it's right there, you can see, and it's medially to the AC joint. It has 2 parts, the conoid ligament and the trapezoid ligament. Both of them together are called coracoclavicular ligament. So the main function of both conoid and trapezoid ligament is to prevent the dislocation of the lateral end of the clavicle and the elevation of the lateral end of the clavicle. So in internal and external rotation, the clavicle is relatively stable and the scapula is moving. So when we talk about external rotation, which is the retraction movement, there is an posterior translation of acromion at AC joint. And when we talk about internal rotation, which is the protraction movement, there is a anterior translation of acromion at AC joint. This is all you need to know, and the plane is transverse plane and the axis is vertical axis. So I will first talk about upward rotation. In upward rotation happens when the tip of your scapula, the inferior tip of the scapula or the bottom tip, as you can see in this picture, goes laterally, which is away from your midline of the body. So when do upward rotation happen? So it happens in two movement, which is first is flexion and second one is abduction. So it can happen in both upward rotation. So what happened in upward rotation at AC joint? So try to imagine when you do upward rotation, the inferior tip is going laterally, which is away from the body. So there is a lateral translation of acromion at AC joint. So downward rotation happens in two movement, which is extension and adduction. So in downward rotation, what happens is the inferior tip of the scapula goes medially, means towards the body or towards the spine, you can say, and there is a medial translation of acromion at AC joint. and the plane in which upward and downward rotation happens is the frontal plane, and the axis is the sagittal axis. Now let's talk about anterior and posterior tipping. So the picture you are seeing is the side view of the scapula. So in anterior tipping, what happens is your acromion goes forward anteriorly and your inferior angle of scapula or the inferior tip of the scapula goes backward. And in posterior tipping, it's opposite, the acromion goes backward and the inferior angle of the scapula or the inferior tip goes forward. So anterior and posterior tipping happens when you do elevation and depression. So in anterior tipping there will be elevation, and in depression there will be a posterior tipping.